So after the braces are removed, the teeth can move wherever they want to move. We all age, we all grow old, our hair changes colour, our skin changes. We can't stop the aging process. The teeth are no exception. Although every effort is made to plan your treatment for long-term stability, retainers are important, like training wheels, so we can start to let the teeth settle into their natural positions. There are two kinds of retainers that we use at the Look Orthodontics. They may be removable retainers that you can take in and out of the mouth, or there may be fixed retainers, which commonly is a very small, thin metal wire glued on the inside of the upper or lower front teeth. The wire retainers stay in indefinitely or long term, or some people call them permanent retainers. They're easy to look after, they work very, very well, and they're a free insurance policy to keep your teeth as straight as possible for the long term. The removable retainers are usually worn 6 months, day and night. After the 6 months, they are only worn night times only, and then eventually they're worn just to the point where you may only be wearing them a couple of nights a week or as required to ensure that your teeth can remain as straight as possible. It's perfectly normal for the retainers to feel a little bit funny when you first get them. You may talk a little bit funny, they may taste a bit funny, you may sound a bit funny, things may just be a little bit funny. It's perfectly normal. Talk as much as possible, because talking helps you get used to the retainers. Most people find within a couple of days to a week maximum, the retainers are not a big deal and they're used to them. We will provide you a case which you can place your retainers into. Look after the retainers really, really well. You don't want to be losing your retainers, and it happens more often than not. Never ever put your retainer in your pocket, in your bag, never wrap it in a tissue. You want to look after them. The fixed retainer is a thin metal wire glued on the inside of the lower and or upper front teeth. It's not designed to be removed, it stays in there long term or indefinitely. If the retainer is ever removed, or if it comes out, then the teeth can move to wherever they want to move. We don't want that to happen. So if you do need a repair or replacement retainer, please let us know so we can arrange this, but the retainer stays in there long term. With the removable retainers, you can brush it under some water with some warm soapy water in a toothbrush, or if there's some stubborn things on there, you can soak it in some diluted white vinegar, 1 part diluted white vinegar, 1 part water, leave it in there for 10 minutes or so, and then give it a scrub afterwards. They come out brand new. If the retainer's not in your mouth, it should be in the case. Never wrap the retainer in a tissue, never put it in your pocket, never put it in your bag. Retainers that are not cared for can get lost or broken, and we don't want this to happen. With your fixed retainer, make sure you're not eating anything hard, sticky or chewy at the front of the mouth. Do all your chewing on the back teeth, and you should find your retainers last you years and years on end. So we'll explain to you how to brush and care for your teeth around your braces. Certainly when your braces come off, we'll clean and polish off all the glue so your teeth are looking the best possible they can be. And if you're a suitable person to have teeth whitening, we can send you back to your dentist to have some simple home whitening procedures or some simple whitening options to make sure your smile is looking the best as possible. After your braces are completed, we will continue seeing you for usually 2 to 3 years after your braces. We usually see you every 4 months or 6 months. We'll keep an eye to make sure your retainers are going well, your teeth are remaining straight, and we'll also recommend that you see your dentist as you would regularly every 6 months or so. After your braces are removed, it's a good idea to visit your dentist, and if you haven't seen them, continue seeing them every 6 months or so as part of your normal recall program.